Hello, coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome back to another 3030 session by AMCI. Hello, everyone. I can see all the chats in the everyone's chat. Okay, coders, let me know. How do I sound? Is it audible? Is it good? Okay. Okay, I can't see anyone typing in the chat. How do I sound, coders? Okay, great. Thank you. Thank you for letting me know. So once again, welcome back to another 3030 session by AMCI. As I promised, we are back with another fantastic topic, especially if you are a coder who's coding for a laboratory services. Yes, today we are covering two important areas, that is organs and disease oriented panels, as well as drug assays. So these comes up a lot of times. These topics comes a lot of time during your exams, and you'll see them often in real world coding as well. So stay tuned. Let's break them down step by step. So first of all, let me read the copyright CPT, copyright 2025 American Medical Association, all rights reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is a copyright of AAPC. Keyword concept FTR Chon AMCI Fab 7, AMCI ICD 10, Flip, Tap, and MCG are the trademark of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. All right, coders. So the both organ and disease oriented panels as well as drug assays falls under the pathology section of your CPT manual. So let's begin with organ or disease oriented panels. And these services are reported with the CPT codes ranging from 80047 through 80076. Okay, so okay, got it. So let's talk about lab panels. So what exactly is a lab panel? A panel is basically a bundle of tests that are routinely ordered together to check on specific organ system, disease, or condition. So each panel actually comes with a predefined set of tests, which makes life easier for healthcare providers. Okay, so why do we use a panel? We use them because they give a big picture of patient's health without ordering each test one by one. Okay, and that means faster diagnosis, smarter treatment planning, and better care. So let's take an example, and we have electrolyte panel over here. So coders, let me know in the chat how many tests are included in an electrolyte panel. Type your answers in the chat. Let me know. I would say we have a carbon dioxide, a chloride, a potassium, and a sodium. Yes, exactly. You are spot on. There are four tests that are included in this electrolyte panel. Spot on, spot on. Now, how about a lipid panel? How many tests are included in a lipid panel? What do you say, coders? Yes, there is a cholesterol serum total, there is a lipoprotein, There's triglyceride. Yes, though there are total three tests that are included in a in a lipid panel. You all are absolutely correct. So remember, coders, an organ or disease oriented panel is basically a bundle of lab tests grouped together to give a clear picture of specific organ or a condition. All right, let's move on. Okay. All right. Now that we know what a panel is, let's move on to some important coding guidelines to keep in mind when reporting a lab panel. So, first one, yes, these following rules will help you to avoid errors and make sure that your coding is accurate every time. So, the first guideline is that all tests must be performed to report a panel. Okay, so here is an example. Electrolyte panel. As we said, there are four tests included in an electrolyte panel. So in case if even if one test in this panel is missing or not performed, you cannot report an electrolyte panel. Is that clear? Instead, you will report all the other tests individually. So remember, all the tests must be performed to report a panel code. Okay, next guideline. Report additional tests separately. So any test not included in the panel should be reported or coded separately. So for example, here along with an electrolyte panel, we have a glucose test as well. So we all know that the glucose test is not included in an electrolyte panel. So we will report an glucose test along with electrolyte panel. So the glucose test should be reported separately. All right, let's look into the next point or next guideline. Do not report two or more panels if they include same test. And the point number 4, it says that if two panels overlap, report the larger panel first and then code remaining tests separately. So let's take an example to explain this guideline. So here we have two panels. One is general health panel and other one is a comprehensive metabolic panel. And coders, if you look carefully, you can see that there are 14 tests that is included in a comprehensive metabolic panel, right? And also this comprehensive metabolic panel is already included in a general health panel. Am I right? Yes, it is already included in a general health panel. So, do we have to report both general health panel and a comprehensive health panel? What do you think? No, right? We don't need to. Yes, these two panels are overlapping and they have the same test as well. So, what will you do? You will report the larger panel. And from this, I can see that general health panel already have 14 tests in it from comprehensive metabolic panel. Along with that, you also have a CBC, complete automated and automated differential WBC count, or a blood count, complete automated and appropriate manual differential WBC count. So that's two tests over there. Okay, so you have 14 plus 2. Also, you have a thyroid stimulating hormone test as well. So in total, 14 plus 2 plus 1, that is a total of 17 tests, right? So general health panel have a total of 17 tests, and that is a larger panel compared to the comprehensive metabolic panel. So you will report the larger panel in this case. Is that clear, coders? Let me know in the chat. Let me know in the chat if it's clear. Okay. All right. So now let me show how I mark my panels to make the coding a lot easier. So here we have a total of 11 panel codes in your CPT manual, and I've marked the number of tests required to build each panel. And trust me, this is going to be super helpful for you. So by checking these markings, you can quickly see whether the required number of tests was actually performed to report a panel. And once you confirm that the number of tests required for a panel is met, the next step is always to verify each test individually. Okay, so you can take a note of these uh, these markings. All right. Okay, now let's move on to the next slide. So now let me give you a quick tip over here, coders. Something you definitely want to be aware when coding basic metabolic panels. So we actually have a CPT, two CPT codes for basic metabolic panel. Yes, one is 80047 and the other one is 80048. And the only difference between these two is that one is coding for a calcium ionized. Yes, 80047 is coding for a calcium ionized, while 80048 is coding for a total calcium. Okay? Yes, over here, let me show you. Yes, 80047 is for a calcium ionized, while okay, coder. So sorry, I think we had some technical issues. Okay, so I am back. Can you hear me now? Can you hear me now? Let me know. All right. So also coders, there is one more test which have two CPT codes in your manual. That is obstetric panel. So again, you can see here there are two codes for obstetric panel. One is 80055. Oops, sorry. One is 80055 and the other one is 80081. Okay. And the only difference between these two codes is that 80081 includes the HIV test along with the rest of obstetric tests. See? Okay. So always make sure you note this in your CPT manual. All right. So now let's do a quick exercise, coders. Let's do a quick exercise. So suppose you have both comprehensive metabolic panel and general health panel ordered for same patient. Which one should you code? Let me know in the chat. Should you code for a comprehensive metabolic panel or a general health panel or both? What do you think? Okay, I will wait for the answers. I can see one answer in the chat. Awesome. Awesome. Yes, this was an example which we done just right now, isn't it? Yes, we will code for a general health panel because we know that comprehensive metabolic panel is already included in your general health panel, and you don't need to report to these two panels together because they are overlapping. Excellent, excellent answers. Let's take another example. Okay, over here, which one will you code? Will you code oops, sorry. So which one will you code? Will you code an electrolyte panel or a comprehensive metabolic panel? What say you coders? We have electrolyte panel and comprehensive metabolic panel. Okay, yes, we will code for comprehensive metabolic panel only because I can see the carbon dioxide, the chloride, and what else? The potassium, also sodium, which is there included in your electrolyte panel, is already included in comprehensive metabolic panel. So we are going to build for comprehensive metabolic panel only. Okay, I've got one more example for you. Over here, we have electrolyte panel and general health panel. Which one you code for? Do you code for an electrolyte panel or a general health panel? Okay, this one is going to be interesting one. Awesome. Great, great, great answers in the chat. Yes, we are going to code for a general health panel because we already saw that comprehensive metabolic panel is included in the general health panel. And yes, the comprehensive metabolic panel consists of all the tests that are mentioned in electrolyte panel. That means electrolyte panel is included in comprehensive metabolic panel, which in turn is included in general health panel. So we are only going to code for a general health panel. So excellent job. I think you all are good with the panels now. So let's move on to the next topic for the day. Let's talk about drug assays. So drug assays are reported with the CPT code 80305 through 80377. And yes, so drug procedures are divided into three main subsections, namely your therapeutic drug assay, drug class testing, and also we have chemistry drug assays. And the drug class testing is in turn again subdivided into two sections. We have presumptive drug class procedures and definitive drug class procedure. So today we are going to focus specifically on drug assays and drug class testing. Okay, so these are the topics which we are specifically going to focus today on. So let's first begin with therapeutic drug assays. And these are the tests that you will frequently uh, see, especially in clinical settings where the patients are on medication that needs monitoring. Yes, so the purpose for therapeutic drug assays is that they are used to monitor a patient's response to a known prescribed medication. So it's basically tells your doctor if a drug is at right level in the patient's system or not. Yes, not too low, not too high. It should be always in the right level, right? So these tests can be run on a variety of specimens like whole blood, serum, plasma, cerebrospinal fluid, and the results are usually quantitative, meaning they are they actually measured in terms of concentration of the drug in your body or in your blood. So depending upon the drugs being monitored, lab will choose appropriate specimen. And for the coding purpose, we use CPT code ranging from 80143 through 80203. All right, so these are the codes which I just mentioned. we have code series from 80143 through 80203, and you can see there are a lot of drugs that are out of numerical sequence or out of numerical sequence order, right? Okay, now that we have talked about therapeutic drug assay, we are moving on to a next classification, that is drug class testing. So there are two tests. Actually, one is presumptive test drug class testing and definitive drug class testing. So presumptive drug testing is your initial screen, thinking of it as a quick check that tells you whether drug might be present or not. And the presumptive test doesn't tells you which exact drug is present. It tells you just the drug class. And these are test labs often run first to screen for possible drug use before moving on to a specific confirmatory testing. Now, I will give you an example. You might see the result saying that it's positive for opiates, but still you don't know whether it's a morphine or a hydrocodone or a codeine. Okay, did you understand? It will just gives you the drug class. Okay, now let's talk about the definitive testing. Definitive testing is much more advanced, and this is where the lab identifies the exact drug and sometimes even exact metabolite that is involved. Okay, so let's first talk in depth about the presumptive drug class testing or presumptive drug class procedure. So here the purpose is to detect the possible use or non-use of a drug or a drug class, and presumptive testing may followed by a definitive test if further identification of the drug or the metabolites is needed. And presumptive testing can be done using several methods such as immunoassay, enzymatic methods, chromatography method without mass spectrometry, or mass spectrometry without adequate drug resolution by chromatography. So these are several techniques which are used, or several methods which are used for presumptive drug class testing. Now, a key point is that all the drugs class immunoassays are considered as presumptive, whether they are qualitative, semi-quantitative, or quantitative. So if you see anywhere saying that the testing was done by immunoassay, that would be considered as a presumptive drug testing. All right, so keep that in mind always. And next, let's look into the CPT code for presumptive drug class procedures. We have first CPT code 80305. It is used for the procedures where the results are read by direct optical observation. This means the lab reads the results visually without any automated analyzers, just by looking into it. You have examples such as dipstick, cups, cards, or cartridges. Okay, and here is a coding tip. Report 80305 only once per date of service, no matter how many direct observation drug class tests were performed or how many results came back. Okay, and this guideline is same for all the three CPT codes, 80305 through 80307. So even if you run multiple dipstick for a different drug, it still just one 80305 for that particular day. Okay, now let's move on to 80306, the next code in presumptive drug class testing. Okay, now these are used when an instrument helps to determine the result of direct optical observation. Examples include the dipstick, the card, and cartridges. But instead of reading them by eye, here these are inserted into instruments which analyze and gives the final result. So basically it's just like adding a little tech to boost your visual test, right? Okay, so now here also you will report these codes only once per day. All right, let's look into the final code 80305. Yes, these are also reported only once per date of service, regardless of how many drug class tests were performed or how many results were obtained. And the next CPT code would be 80307, and this is used to report any this is used to report any number of device or procedures performed by instrumented chemical analyzer. So that is your keyword. It uses instrumented chemical analyzers, and there are many different instrumented methods to perform a presumptive drug assay, including the immunoassay, chromatography, or mass spectrometry. So these are the methods which are used to do a presumptive uh, these are the methods which are used to report 80307. Okay, all right, so let's move on to the next slide. Now that we have covered the presumptive drug class testing, let's move on to a definitive drug class procedures. And these tests, as I said before, these tests are actually used to identify specific drugs or metabolites, giving you precise results. So what is a goal for a definitive, so what is a goal for a definitive drug testing? Oops. Okay. Yes. So what is the goal for a definitive drug testing? These are used, as I said, to identify specific drugs and their metabolites. And they also used to distinguish between structural isomers. And they can be qualitative, quantitative, or both. And a definitive drug testing is performed using some advanced methods such as gas chromatography, mass spectrometry, liquid chromatography, mass spectrometry. And importantly, the point which you have to remember is that immunoassay and enzymatic methods are excluded here, and they are only to be used for presumptive testing. So for coding purpose, definitive drug class falls under CPT code 80320 through 80377. All right, so that was all about definitive drug class procedures, and we have got some more guidelines to cover over here. So each drug class or specific metabolites are reported only once per date of service. The metabolites, which are the breakdown products of drugs, are not reported separately unless they are specifically listed as a separate category in definitive drug class listing. Now, what's a definitive drug class listing? We will go into we will discuss about in the upcoming slides. Okay, and codes are assigned based on number of analytes tested within a class. So if an example, I will give you an example. If a lab analyzes 5 or more amphetamines or their metabolites, you would report 80326. Can see the CPT codes over here. So if you have 5 or more amphetamine metabolites, yes, you have to code that one 80326. If it was only 3 or 4, you would report 80325. It was just 1 or 2, you would report 80324. So codes are assigned based on number of analytes tested within each class. Okay, and next guideline. Yes, unlisted codes 80375 through 80377 are used when drug or analyte tested is not specifically listed in 80320 through 80373 range. However, if that analyte is listed elsewhere, for example, under a therapeutic drug assay classification or chemistry classification, you should report it using specific code range instead. Okay, so if the metabolite is listed in these classification, then you will have to report from that particular section. Okay, you won't use the unlisted code in such scenarios. All right, so these are the CPT codes which are used for definitive drug testing. The CPT codes ranges from 80320 through 80377. Yes, so this was the definitive drug class listing table which I was talking about, and this table is found in your CPT manual, and it tells you which drug or metabolite belong to each definitive drug class. Okay, this is a super useful table, and if a metabolite isn't listed in this group, you will group with its parent drug. Okay, now let me do some exercise. You can join with me in the chat and let me know. To report a definitive testing for a methamphetamine, yes, methamphetamine, using this definitive drug class listing a table, which code or which range of codes will you use? Take your time, coders, and let me know in the chat. So which drug class does a methamphetamine belong to? Can you locate using this table? Okay, I can't see any answers in the chat. Are you able to find? Okay, let me help you on this one. So you can find the methamphetamine, yes, over here, and the code range you can also see. It belongs to the amphetamine drug class. There you go. We have one answer in the chat. Excellent. So were you able to locate it, coders? Let me know in the chat. Were you able to locate it? Yes, it can be coded from the code sequence ranging from 80324 to 80326. Okay, now let me do another example. To report a definitive testing of codeine, hydrocodone, or hydromorphone or morphine, which drug class does it belong, or which CPT code will you use? So you can use this definitive drug class listing table, and you can identify. Okay, so this can be found under, yes, over here. It can be found under the opiate class. Okay, there you go. Under opiates, you can see codeine, dihydrocodeine, hydrocodone, and hydromorphone and morphine. And the CPT code, exactly. There you go. We have one answer in the chat. Fantastic, fantastic, fantastic. Yes, that's the correct answer. It belongs to opiate class, and the CPT code used would be 80361. So coders, go ahead, and if you get time, just have a look into this definitive drug class listing, and it will really help you to find the code. There you go. We have one more answer. Great job. Okay, okay. So I think you all are ready for some coding exercise. Now it's time for us to move on to some coding exercise. And here we go. We have our first exercise. I would read the last portion of the question first. Of the following, which CPT code most accurately describe the lab services? Your options are option A 80055, option B 80081, option C 85027, 85004, 87340, 86762, 86780, 86900, 86850, 86901, option D 85 027 8500 4 87340 86726 86592 86900 86850 86901. A pregnant patient presents for her initial prenatal evaluation. The physician orders a full obstetric screening to assess maternal health and detect infection that could affect pregnancy. So the tests performed are blood count CBC, automated differential WBC. Third one, hepatitis B surface antigen. Fourth one, rubella antibody IgG. Fifth one, syphilis screening, treponemal antibody test. Sixth one, blood typing ABO. Seventh one, antibody screening RBC. And eighth one, blood typing RHD. So which CPT code most accurately describes these lab services? And coders, you have 2 minutes, because I took half minute to read the entire scenario. It was a long one. So I'll give you 2 minutes to answer. I can see some answers are already in the chat. Okay, so good one. Let we will see after 2 minutes. All the best, coders. Okay. So answers are all locked in the chat. So let's go ahead and let's review this scenario. Okay, got it. So here we have a patient who's here for a prenatal evaluation, right? And a series of lab tests were performed for the patient as well. Okay, so there are four options, two options, option A and option B are 80055 and 80061. These two are obstetric panel codes. And let's first look at option B, that is 80081. So yes, as I said in the beginning of the panel review, 80081 has 9 tests and 80055 has 8 tests in them. And the only difference in AIDS between these two panels is that 80081 has one additional test along with the other common test, that is HIV antibody test, right? Yes, antigen with HIV antibody test. So did we have a HIV test performed in our scenario? We had 8 tests performed. Did we have an HIV test performed? Okay. So someone has mentioned that 80051 is good, but 80081 is complete. Did we have a HIV test coders? First, I want you all to look into that. No, right? There was no HIV antigen or antibody test performed among these 8 tests mentioned over here. So that means it's not going to be option B. Okay. So brace yourself, coders, for an aha moment over here. If you read the parenthetical guideline over here, it states that when syphilis screening is performed using a treponemal antibody approach, that is 86780, do not use 80081. Instead, use the individual codes for the test performed in obstetric panel. And in our scenario, the syphilis screening was performed using a treponemal, I hope I'm pronouncing it correctly, treponemal antibody testing, right? And the same guideline applies to 80055 as well. Over here also it's mentioned when syphilis screening is performed using a treponemal antibody approach, do not use 80055 as well. You have to use the individual codes for the test performed in the obstetric panel, right? So what are we going to do? Is this a complete panel? No, it's not a complete panel. We have one test missing. The syphilis screening was not performed using strep normal antibody test. So we have to code for all the individual tests performed. That would be your CBC 85025. Okay, so you have to code for all the remaining tests. Now between option C and option D, if you go to option D, you will see it is coding for 86592, and 86592 is also for a syphilis screening using a non treponemal technique. Yes, non treponemal antibody qualitative technique. So if a treponemal method was used, you would code 80, it would qualify to code for 80055. So we had a treponemal antibody test performed, and that makes option D also incorrect, and we have to code all the tests individually. That would be CBC 85027, 85004 for automated differential WBC count, 87340 for hepatitis B surface antigen, your rubella antibody 86762, then 86780 for syphilis screening strep antibody test, the blood typing ABO 86900, 86850 for antibody screen, RBC, also the last test, which is blood typing RHD, that would be coding for 86901. Yes, I can see a lot of people are changing the answers in the chat. Yes, option C is going to be the correct answer. Was that an aha moment? There was no mention of individual tests. So these are the individual tests that would form a panel. So if one of the tests is not performed, then the panel is incomplete. Then you have to code them separately. Code all these tests alone individually. Okay, did the explanation help? Yes, I can see a lot of aha moment in the chat. Great. So if you have learned something, that is priceless. Excellent job, coders. Let's move on to the next scenario. Exercise number 2. Of the following test, which best describe the laboratory service performed? Options are option A 80053, option B 80047, 84155, option C 80048, 84155, option D 80053 with a 52 modifier. A patient experiencing fatigue undergo lab testing, which includes the following tests: your glucose, total calcium, sodium, potassium, chloride, bicarbonate, creatinine, blood, urea, nitrogen, albumin, alkaline phosphatase, alanine aminotransferase, aspartate aminotransferase, and total bilirubin and total protein. Of the following answers, which best describe the laboratory service performed? And Codis, you got 2 minutes. 2 minutes to answer this one, and your time begins now. All right. Great coding once again. Let's solve this scenario together. So here we have a patient who presents with a fatigue and the following test was performed. So there were 14 tests performed in this scenario. Okay, so yeah, I have marked all my 14 tests over here. You can see them. And this is how the marking number of tests for each panels helps you, right? So you can see from this scenario how it is going to help you. In yes, churning is very important, and this is how churn helps you. So here we have, okay, give me a moment, coders. Okay, so here we have option B and C coding for 80047 and 80048 respectively, and they are also coding for 84155. So 80047 have 8 tests in that panel, same with the 80048. Okay, and also you have 84155 in both the code options. So total you will have 9 lab tests performed in option B and option C. So from my procedure inventory, I can see there were 14 tests performed, not 9 tests. So straight away that helps me to eliminate option B and option C. Yes, option B and option C both are incorrect. Now we are left with option A and option D. Both are coding for 80053. And once again, I have marked the number of tests in comprehensive metabolic panel, and that was 14. So the numbers are matching exactly. Now, since we have same code, I don't need to go and read all the tests. I have done it prior. So for an exam, you can also verify the test performed with your procedure inventory. Okay, so we have 14 tests in comprehensive metabolic panel, and those 14 tests are listed in the procedure inventory. So you should not report a 52 modifier with the panel code. If any test is missing, then you have to code all the lab tests individually. Never use a 52 modifier here. Okay, so the correct answer, as most of you have said, is option A. Yes. Great job. Let's move on to exercise number 3. You all are doing a fantastic job. Okay, of the following, which best describe the test? Option A, 80050, 8443. Sorry, that is 84443. Okay, and option B, 80050, 80051, 84443. Option C, 80050, 80051, 8443, 80053. Option D, 80050. The patient presented with symptoms of fatigue, weight loss, and generalized weakness. The patient's medical history and physical examination suggested the need for a thorough evaluation and of metabolic and general health status. A comprehensive metabolic panel, general health panel, electrolyte panel, and TSH were ordered to assess patient's organ function, electrolyte balance, and overall metabolic state. Impression, normal labs of the following, which best describe the test performed. You got 2 minutes, coders. I know you're going to rock it. All the best. I love what I'm seeing in the chat. Excellent, excellent. So there are all options are there in the chat, and there's a good interaction going on as well. So okay, Kodas, let me walk you through the scenario. So these are the panels and the lab tests which we have in our scenario. The patient came with fatigue, weight loss, generalized weakness, and these procedures, these lab tests was performed. We had a comprehensive metabolic panel. We have a general health panel, electrolyte panel, and TSH as well. Okay, so the code 80051, which is for electrolyte panel, is coding for carbon dioxide, chloride, potassium, and sodium. And coders, if you remember from the exercise which we did in the beginning, we know that electrolyte panel test, all the tests are included in the comprehensive metabolic panel, right? Yes, the carbon dioxide, the chloride, the potassium, and sodium, all of them are included in your comprehensive metabolic panel. So we don't need to code a electrolyte panel and a comprehensive metabolic panel. We only need to code a comprehensive metabolic panel in this case. Also, if you take a closer look, coders, if you take a closer look, you can see that the comprehensive metabolic panel is also included in your general health panel. There you go. Yes, this was also one of the exercises which we did in the beginning. So comprehensive metabolic panel is also overlapping with your general health panel. And the general health panel have 17 tests, right? So if you have overlapping tests, what will you do? You will be coding for the larger panel. So you can't code 80053, you have to code for 80050. So that eliminates your option. Yes, there you go. This is the guideline which you have to follow, and it eliminates option B, option C. Both are incorrect. You are left with option A and option D. And option A coding for a general health panel and a TSH 844. I said it was 84443. That is for a TSH, which is thyroid stimulating hormone. And if I take a closer look, I can see TSH is also included in the general health panel. So again, I don't need to code them separately. I don't need to unbundle them, right? It is bundled into general health panel. That makes option A also incorrect. I saw that many of you changed from option A to option D. Fantastic. It's a good thing you found where you went wrong and you corrected it corrected it. So that's a good habit. So option D is going to be the correct answer. Wonderful job, coders. Let's quickly move on. Okay, let's quickly move on to exercise number 4. I have some more scenarios for you today. Okay, of the following answers, which CPT code best describe the test performed? Option A 80305, option B 80306, option C 80307, option D 80324, 80353, 80349, and 80362. Mr. Colin, a 29-year-old male participating in a substance abuse treatment program, presents for a routine urine drug screening. Okay, and the clinic performs a test using cartridge-based immunoassay system that is placed into an automated analyzer which reads and interprets the optical signal to detect the presence or absence of various drug class. The analyzer identifies multiple drug classes, including amphetamines, cocaine, opiates, and cannabinoids. Of the following answers, which best describe the test performed? All right, coders, your time begins now. All right, Koda. So since we're running out of time, I'm going to walk you through this scenario. So if you have your answers, you can place them in the chat. Okay. Or if you're still working on it, please continue. Okay. Give your best answers. Give your best answers. All right, don't worry, don't worry. We are here. We are here to solve this one together. So here we have a patient with for a drug screening and a drug cartridge immunoassay test was performed. Okay, and option D is coding for 80324, 80349, and 80353 and 80362. These are for a definitive drug testing. So my question is, did we have a definitive drug testing in this scenario or a presumptive drug testing? What do you think, Otis? We had a presumptive drug testing in this scenario. You can see that patient came for a screening purpose, all right, and a cartridge based immunoassay system was used, and it is used just to detect the presence or absence of the drug class. It is not used to find the exact drug or its metabolite. Okay, so it's just a screening test that is performed. That is an initial screening test, and that is a presumptive test, drug testing, not a definitive drug testing. All right. And also, if you see, you can see that a immunoassay system was used. And yes, you have the guidelines which states that under the definitive drug testing that this testing exclude the immunoassay and enzymatic method. So any test performed using an immunoassay or enzymatic, that is not considered as a definitive drug testing. It will fall under your presumptive drug testing. Okay, so that is also an easy way to understand, easy way to get it correct. Yes, I can see a lot of people changing the answers. Good job. So option D is incorrect. It's not a definitive drug testing that was performed. Okay, now option 80305, which is option A, that is coding for a drug test presumptive any number sorry, any number of drug class, any devices or procedures capable of being read by direct optical observation. So, was the result or the test performed by direct optical observation in our scenario? Let's go and let's read the scenario once again. So, you can see the clinic performs using a cartridge based immunoassay system that is placed into an automated analyzer, and that analyzer will read and interprets optical signal to detect the presence or absence of the various drug class, right? Yes, so it was not, even though it was not a direct optical observation, we used an instrument in order to get the result using a direct optical. Yes, so option A is wrong. Option B, 80306, you can see that it uses a instrument assisted direct optical observation, and that's exactly what happened in our scenario. Okay. Okay, great, great. So I hope this explanation helped, and I hope it's very clear how to differentiate between a definitive drug testing and a presumptive drug testing. And also, option C is incorrect because that uses an instrument chemistry analyzer. So that's much more complex or complicated methods used over in 80307, which was not performed in our scenario. It was done using an automated analyzer which read and interpret the optical signal. So it was an instrument assisted direct optical observation performed here. So excellent job, coders. I hope you all learned something from here, and that makes your option B as a correct answer. Okay, let's do one more scenario on these drug testing. Here we go. of the following answers which best describe the test performed? Option A 80307, 80305, 80349. Option B 80345, 80346 times 3, 80349. Option C 80345, 80346, 80349. Option D 80307, 80332, 80349. Miss Romson, a 24-year-old male, sorry, it's Mr. Romson, a 24-year-old male with a history of drug abuse presented to the ER unconscious and was stabilized with airway management and intravenous fluids. Based on patient's history, the physician ordered definitive drug testing for thiopentol, clonazepam, alprazolam, marijuana, and nitrazepam. The lab confirmed the presence of these substances with the patient's plasma, indicating significant drug use. Of the following answers, which best describe the test performed? Okay, coders, let me know your answers. So quickly, let me know your answers. Give your best answers. I will give you 2 minutes to place your answers in the chat. Okay, great. Great to see a lot of people had an aha moment and the explanation helped. Thank you. Thank you for letting me know. All right, coders, that is time. What say you? Let me know in the chat. Give your best answers. Give your best answers in the chat. Okay, I know where you are stuck. You all are stuck at uh, which options. I know that. So let me walk you through this scenario as well. We have a patient with a history of drug abuse, and in procedure inventory, a definitive drug testing was performed. Okay, and the definitive drug testing, it was mentioned that it is a definitive drug testing, by the way. So there's no confusion in this scenario. And we had a thiopentol, clonazepam, alprazolam, and marijuana and nitrazepam. So you can see these are specific drugs that was tested. So of course it is going to be a definitive drug testing. Okay, so these testing was performed on the following drugs, and these are the code options. So option 80305 and 80307, right? Both are coding for a presumptive drug testing. So it's very clear from the scenario. We had a definitive drug testing, not a presumptive drug testing, which eliminates option. Yes, over here it's mentioned it's a definitive drug testing, which eliminates option A and option D. Okay, so okay, no one went for option A and D. That is excellent. So we are left with option B and C. I know you were confused between option B and C. So let's see which is going to be the correct answer. Okay, so this is the definitive drug listing with the help of which we are going to pick the correct answer. Okay, so we have a definitive testing performed on thiopentol. So you can see thiopentol is a drug and it belongs to the class of barbiturates, right? Do you all agree with me on this? Let me know in the chat. And we have clonazepam and alprazolam as well as nitrazepam. All these drugs belongs to benzodiazepine drug group, drug class, right? Okay, so the code for barbiturate would be 80345. The code for benzodiazepam, that would be 80346 or the 80347. So we will look into it later. And we have also had, yes, we also had a marijuana, and that belongs to the drug class of 80349. Okay, so marijuana belong to specifically to the drug class 80349, cannabinoids natural. And now let's look into these codes. So barbiturates, it's straightforward, 80345. Benzodiazepams, there you go. So we had under benzodiazepam we had alprazolam, alprazolam, clonazepam, and nitrazepam performed. So that's three drugs under the classification of benzodiazepam. And 80346 is coding for benzodiazepam up to 1 to 12 drugs or metabolites, right? And if you had more than 12, that is 13 or more, you would use 80347. So do we have to code 80346 times 3 in this scenario? Let's say you code this. Do we have to code? No, right? So yes, that eliminates option C, sorry, option B. And cannabinoids, we have only one code, that would be 80349. That's a straightforward. So the correct answer is going to be option C, 80345, 80346, and 80349. You all rocked it. You all rocked it. Let me know, chorus. Did the explanation help? And are you able to distinguish between a definitive drug class testing and a presumptive drug testing? Yes, good job, good job, good job. So let us wind up with some poll exercise, hand poll exercise as always. Okay, Codus, this is a rapid fire round, and these are your questions. First one, which of the following statement is true when coding for an organ or a disease panel? Options are option A, you may report the individual tests separately even if they are the part of panel. Option B, all tests in the panel must be performed to report the panel. Option C, you can split a panel and report only some of the tests performed. Option D, panels may be reported more than once if they report. So which of the following statement are true? There you go. You there are a lot of fast coders out here today with us. And I know you all are the same people who do excellent, you who do very quickly, and you all answer this question based on the guidelines. Yes. So excellent answers. Yes, it's going to be option B. If you have a panel, all the tests in the panels must be performed to report a panel code. If anything is missing, then you will code for the individual test. Excellent job. Wonderful job, coders. Let's move on to the next one. If two panels overlap in the test, they include, how should they be coded? Okay. And options are report both panel as usual. Report the smaller panel first and then the larger one. Report the larger panel first and then code the remaining tests separately. Split the panels and report each test individually. Which one is true, coders? Okay, once again, we have a lot of fast coders. Yes, the correct answer would be option C. If two panel overlaps, always remember, coders, turn your manual as well. Report the larger panel first and then code for the remaining tests separately. Wonderful, wonderful, wonderful. Let's go on to the next one. What is not allowed when coding for an organ or disease panels? Option A, reporting additional tests performed beyond the panel. Option B, using the larger panel first when panel overlap. Option C, report two or more panel that include same test. Option D, report a panel only if all included tests were performed. What say you, coders? Okay, all right. Any more answers? Quickly let me know. Any more entries? Okay, okay, great. Yes, option C would be the correct answer. So reporting two or more panels that include the same test. Okay, that is not allowed. If overlap happens, you know what to do. Yes. Okay, let's move on to the next one. Presumptive drug screening tests are typically used to option A, confirm exact drug and concentration in patient system. Option B, screen for possible presence of the drug before confirmatory testing. Option C, replace the need for a doctor's clinical judgment. Okay, that's interesting. Option D, report definitive result to insurance companies. What say you? Okay, quick answers in the chat. Shall I reveal the correct answer? Okay, the correct answer is going to be, of course, it's option B, screen for possible presence of the drugs before you do a confirmatory testing. Yes, and that's confirmatory testing is your definitive drug testing. Okay, let's move on to the next one. All right. A doctor orders a definitive drug testing after positive presumptive testing. What is the primary purpose? Option A, to confirm drugs a patient's symptoms. Option B, to identify specific substance present in the system. Option C, to screen for any possible drug use. Option D, to satisfy insurance paper requirements. What do you think, Otis? Which is the correct one? All right, okay. Have two people saying it's option B. How about the rest of you? Do you agree? It's option. Is it option B? Anyone more who supports option B for this scenario? Okay, there you go. We have more answers. We have more people going with option B. And of course, yes, it is option B. Excellent. It is done to identify the specific substance that is present in the system. Okay, all right, all right, all right. So I think with that, we come to an end of today's session. So if you enjoyed the video, coders, please smash that like button, subscribe, and share it with someone who needs to see this. Okay, and I am placing the chat in the survey link in the chat as well. Please let us know if you liked the video to presentations, and we'll see you all next week. Thank you, team, for joining with me today and supporting all the coders over here. Thank you, coders, for coming for another 3030 session. We will see next week with another great topic. Hope you all enjoyed today's session, and thank you, and stay safe. Keep coding.